Delhiites and people living in the national capital region continue to live in extremely toxic air. This is through figures released by the government's own Central Pollution Control Board, wherein the AQI, even as of today, has crossed 400 at many stations. On an average, also, we are breathing in very poor air quality, which is currently in the 360 category. Just 2 days ago, the AQI remained above the 400 mark as well. Today was also supposed to be a day wherein in the parliament, our representatives were supposed to discuss the ill effects and the solutions forward, but the House has been adjourned. Joining us now to discuss more on the adverse health impact of long-term exposure of severe quality air, I'm being joined by Dr. Saurabh Mittal of the Pulmonary Department here at the AIIMS New Delhi. So thank you for your time. First off, we've heard a lot of doctors call the situation that people are living in an air emergency. Where do you stand on such a stance?
So I think calling it as emergency is more like creating a public panic, which should not be done. But this is definitely an health hazard, which we all have been living for past few years. So if we see over the years, like in last 10 years, we have seen that the air quality has progressively worsened because of the various reasons. And it is leading to a lot of problems to the natives of Delhi or the patients who are visiting us. So yes, this is a major medical emergency kind of situation which we need to tackle so that we can prevent a lot of diseases and the hospital admissions.
Sir, today another point was made that is right now taking the ire of the opposition party leaders. Sorry to bring politics into this, but because this is also a matter which, because of politics, we have seen a lot of bills get passed and also get delayed. That is why I'm bringing this up. The MOS for Environment, Mr. Kirti Vardhan Singh, today in Parliament, has reiterated the government stance of finding no link between deaths or lung diseases with high AQI. In the past, we've heard doctors speak about how long-term exposure can result in diseases. How do you take these statements that are being made on the table of the parliament?
So let me tell you one thing which is very clear. So to have a causal link between two things is very difficult. So you have one disease that can be caused by multiple factors. So that is how the system works, that you have, supposedly you have asthma, it can happen because of smoking, it can happen because of your growth problems, it can happen because of air pollutions. So once you have a disease which is caused by multiple factors, it is generally difficult to quantify how much is contributed by the air pollution. But there is data which suggests that poor air quality is associated with increased incidence of respiratory diseases, increased incidence of hospital admissions. So there are studies, I think from AIIMS, it was somewhere in 2002 or 3, and one study was published in 2019 in children, that poor air quality times are associated with increased emergency visits for children. So it tells you that yes, this is a problem which is causing medical problems. So have a conclusive outcome that okay, air pollution caused this, that is difficult, but it is generally the data on modeling, specifically for the statistical analysis models, have suggested that poor air quality exposure for a long term leads to probably reduced lifespan as well as increased risk of many diseases and including cancers.
Reduced lifespan, increased risk of many diseases, that has been the outcome of model studies as well as what you have also as a doctor witnessed in the past due to increased visits. Sir, in this scenario, do you think that statements, blanket statements denying link between respiratory illnesses and air quality without giving such context, should that also be done? Because ultimately people refer to these records in order to make up their attitudes around dealing with air pollution as well.
So I think that's a very little political statement, so I would not really comment on that, but I would really want to say that, I mean, as a medical scientist being here, the data from the medical community looks that AQI is, poor AQI is associated with health risks, and public has to accept it that way rather than anything else. So we all have seen data, we all have seen that it is associated with some degree of complications. So from the public perspective, it is important that they need to have personal protective measures so that they can reduce exposures, and they need to obviously contribute towards the improvement of air quality by various measures in which public can contribute.
Right. So you've mentioned about public taking up personal protective measures as well. We're living in an era of 400, 300 plus AQI. However, not many people take to even wearing a basic mask. Firstly, Can a mask even be effective in such high AQI? And secondly, do people develop an immunity with continued long-term exposure to AQI?
So masks do work. So mask means N95 mask, a good quality, properly worn N95 mask prevents a lot of exposure. So I always go out with an N95 mask and I ask my colleagues, and if you see around the hospital, a lot of people will be wearing a N95 mask. Although there are problems with the mask that it causes some degree of claustrophobia or difficulty in breathing for some people, but I suggest that whenever you go out for short periods, preferably wear a N95 mask so that you can reduce your exposure. Now if we talk about the immunity, so this is a very wrong concept, and I have been getting a lot of questions from the patients and relatives that if we are exposed to high pollution, will we develop immunity to it? So this is wrong. So if you are working out in high pollution environment, you are harming yourself. So that is very important. There is no immunity to pollution. It's not an infection so that you get immune to it. It's a pollutant which gets into your body and causes harm. So avoid thinking that if you are exposed to high pollution, you will develop immunity. The clear answer is no.
Right. So, final question would be on other measures also that people can then take in order to protect themselves and their long-term health. Some have even recommended that people stay out of Delhi in case there is an aggravated and exacerbation of pre-existing conditions.
So I would say that is not a practical solution and feasible for most people. So there are solutions which can be done. So I mean, if you are planning to move out of city, it's better that you stay indoor. So if you can move for work out of city, you can stay indoor and work whatever you want to do. So that is one thing, because if you stay indoor with closed windows and doors, the air quality is significantly better indoor. The second thing is that if you can afford a good quality air purifier, which many of us can, not all, and not a lot of us can afford, but those who can, they should. So if somebody can afford to move city, they can definitely afford an air purifier and they can stay in and kind of take this time over for next 1 or 2 months, and then things get better, but obviously they are never the best.
So finally, because we are sitting inside of the AIIMS campus as well, the AQI outside is also quite poor. Are there any effects of such an ambient air quality on the treatment of patients inside hospitals? And would you be able to tell us how much more visits do you get during such a time when as far as respiratory illnesses are concerned?
So in general, what we are seeing right now in our OPD, that we are getting patients who were stable before and now they are coming with increased symptoms. So we need to kind of increase their treatment so that their symptoms can be relieved. And it's, I would say, around 10-15% of our patients are coming with increased symptoms from what they were before. So obviously there is an increased risk of exacerbations in the poor air quality. Indoor patient management is generally same, but because patients are requiring emergency visits and some of them do require hospitalization, so yes, it is associated with, I mean, more requirement of treatment, whether it is nebulizers or inhalers or steroids or antibiotics, that is required from the patient side.
Thank you so much for your time, sir. This was, in fact, Dr. Saurabh Mittal here of the Pulmonary Department joining us on Times Now. With video journalist Junaid, this is Kritika Tiwari reporting from Delhi.